A fascinating new study is raising awareness about young people who are undergoing cancer treatment and the fertility challenges that lie ahead. The study shows that the effects can be devastating for a survivor who wants to start a family but can't. So here to shed a little light on this issue is cancer survivor Mark Stewart and Dr. Abha Gupta, medical director of the Adolescent and Young Adult Oncology Program at Princess Margaret Cancer Center. Good morning to you both.
Good morning.
I want to get right into your story, Mark. You are a cancer survivor. You were diagnosed with cancer at the age of 18. What was that like for you?
It was a very difficult process. When you're 18 years old, you're starting to begin your life. You're making long-term plans. And so when I was 18 years old, I had those long-term plans ready to go. And then all of a sudden, I was diagnosed with cancer, not even told, or not even, really prepared for anything like that at the time. So it was quite a difficult process. But I've managed to, to build myself back up. But at the same time, it was quite daunting then.
I've spoken with a lot of young cancer survivors, and the survival rates for childhood cancers are improving all of the time, and we focus so much on getting through that battle. As a young man, were you thinking 10, 15 years down the road to where you might want to start a family?
I never really thought that I would die, quite frankly. I always thought I would be one of those survivors, and the rates are improving, and that's wonderful. But no, I wasn't really thinking that far ahead. You have to look forward to the next chemo treatments and just get through those, and the operation which I had, which removed the tumor and gave me a prosthetic knee. So no, I wasn't. It was really a case of just get through the next treatment and hope you're not as sick as you were last time.
Dr. Gupta, when you're dealing with young patients, what you want to do is fight the battle that's right in front of you. But at what point do we let patients know that this could be a concern later on? Because the numbers are surprising from the study.
Absolutely. And in fact, we're increasing our efforts to educate oncologists and oncology providers to highlight the fact that fertility is an important issue right at the beginning. There's opportunity at the beginning prior to cancer therapy to actually deliver consistent information to all patients regarding this very important issue.
Break that down for us. What kind of challenges could they be facing?
So right now, a conversation needs to happen with the patient about their fertility before cancer treatment. But often oncology providers feel nervous because they're not necessarily equipped with all of the information required to actually offer that information properly. So for example, we might make judgments for patients ourselves and say, this person doesn't need any fertility information because they're likely to pass away from their cancer, or because they already have 4 children, or because of their personal family or relationship status. And we are trying to educate providers to say it's not our call. It is not our job to triage who gets the information or not. So every single patient, regardless of age, gender, geography, cancer diagnosis or prognosis, deserves consistent information regarding, number 1, the risk to their fertility in the future, number 2, the options to preserve their fertility if feasible and practical, and number 3, the opportunity to actually think about that decision before they actually start cancer therapy. Sometimes a physician has to say to the patient, you know what, you're actually too sick to actually go through sperm banking or go through egg harvesting to preserve your fertility, but you are going to be infertile after treatment.
Those are 2 of the options, I'm guessing, then, that younger cancer patients have. Are those the only 2?
So up front, prior to diagnosis for men, ejaculation followed by sperm banking of their sperm is the number 1 most important method of preserving fertility. For women, preserving their eggs is the most important. But what's also important, actually, is to check with the survivor after therapy is done, because there might still be an opportunity to have children following cancer therapy, and we cannot assume that every patient is infertile following the completion of cancer therapy. So we always encourage young people to check in with their providers and assess their fertility after cancer treatment has been completed.
The study highlights a fascinating part of cancer treatment and one that's not talked about a lot, so I'm glad that you're here to explain more of it to us today. Mark, I want to give you the final word. What's life like for you now?
Oh, it's good. I live a normal life. I go to work every day and do my very best. It has been over the 22 years that I've been a survivor, difficult at times, bringing matters like this up. But this report brings it to the public's awareness, and it's something that I'm proud to be talking about today. So For on-call fertility issues for adolescent and AYA survivors is very important, and I encourage anyone to look this report up and give it some careful consideration.
Thank you for lending your voice to this topic today.
You're welcome.
And thank you both for being here.
Thank you.